Hi, I'm Dr. V. I'm Chief of the Spine Pain Program at Bloor Pain Specialists, and today I'm going to be talking about MRI.
What can be done to treat transitional vertebra or reduce symptoms?
So a transitional vertebra, it depends really if it's fused or not fused. If it's partially fused or not quite there, then there's an element of mobility and strain. And so stabilization of the musculature really is the go-to. That's where people are going to have the most improvement. If it is fused, and in some cases where it's not fully fused, the adjacent segment, the bones on top, the disc on top, will take much more force because it's not really receiving the cushioning that it's supposed to with an extra bone and an extra disc. And with that, there can be more pain and more symptoms from the higher levels. So what can people do to prevent that? Knowing that they have this diagnosis, they can maintain their core stability, do yoga, Pilates, maintain exercises that work not only on power, but more so on endurance, so that their muscles are working for them even when they're not paying attention to their musculature. That is by and large the most effective thing for prevention of the worsening of the symptoms. In some cases, people have had portions of their transitional vertebra excised surgically, meaning they go for surgery, they cut away pieces of that bone. But remember, things do attach to these bones, so we have some mobility. There's a purpose to them. And so surgical outcomes are mixed. Sometimes there's scar tissue, sometimes there are other things that develop, and sometimes new pains. And so it's not a perfect option, but it certainly is an option as well for some. Here at Bloor Pain Specialists, we often use what's called radiofrequency ablation. And we've had videos on this in the past, so you can reference back to those. But radiofrequency ablation is the use of heat energy at the tip of a needle with a wire on the back end to heat up the nerve endings that flow over those transitional vertebrae. I use those, as my colleagues do as well, to heat up those nerve endings so people can't feel that connection with the neighboring bone. They can't feel the strain. In some cases, it's not just for the transitional vertebra, but for the adjacent segments, because life's happened. People have used their bodies. People maybe have gotten tired over the years, so gained that weight, haven't been as active as they wanted to, and the strain is already there. So sometimes they need the help and they need the treatment of levels above. And if that's what the patient needs, that's what we provide. Thanks for watching today's video. Please like and subscribe below. If you have any questions that you'd like us to address in a future video, please leave them in the comments area. If you want us to answer any questions about your care specifically, please contact the clinic directly.